The colder months have finally arrived, and that also means flu season. According to the National Institutes of Health, the flu is an airborne illness that can be transmitted to another person from as far as 6 feet. So it's important to know when to stay home in order to protect yourself and others from catching the flu virus. We stopped by Baylor Scott and White Health in Georgetown, Texas, and talked to Dr. Candida Suffridge to find out everything you need to know about the flu, prevention, and treatment. With a few simple steps, you can help protect yourself from catching that nasty flu virus. According to the Mayo Clinic, the influenza or flu virus is a viral infection that attacks your respiratory system. For most people, the flu resolves on its own, but sometimes influenza and its complications can be deadly. So how do you protect yourself from the flu in the first place?
The best ways to protect yourself from flu is number 1, get the flu shot every year. And number 2, if you are sick or you're around people that are sick, you wash your hands and keep your mouth covered when you cough to avoid catching it in the first place.
If you are feeling sick and you think you're coming down with something, you should be aware of the flu symptoms, which differ from the cold.
The most important thing to remember about the flu is that it comes on suddenly. This is much different than the colds that we see on a day-to-day basis. So a sudden fever and especially body aches likely indicates that you've been exposed to the flu, as opposed to a cold, which is more runny nose, sore throat, generally run down.
If you do suspect you have the flu, you should stay home. You don't want to expose anyone at school or work to the flu. If you have a fever, ibuprofen and Tylenol can help keep the fever at bay. If you are in a high-risk group, such as older individuals, children under the age of 2, or have a chronic illness, you should see your primary care physician right away. The flu shot is highly recommended in order to protect yourself from the flu virus. So who is a good candidate?
Every individual over the age of 6 months old should get a flu shot every year. Those who are especially vulnerable to the flu would be little children under the age of 2, older individuals 65 and up. Certainly anyone that's pregnant needs to make sure they get the flu vaccine. And then those with chronic illnesses such as diabetes or lung diseases like asthma.
The flu shot usually becomes available in September and October. It takes about 2 weeks to kick in, so you want to make sure to get the vaccine before flu season arrives. In the United States, flu season occurs in the winter, but flu outbreaks can happen as early as October and can last as late as May, according to the CDC. A common misconception is that you will get the flu if you get the flu shot. But is this true?
You cannot get the flu from the flu shot. This has been proven time and time again.
If you do happen to get the flu, you'll usually need nothing more than bed rest and plenty of fluids to treat the virus. But in some cases, a doctor can prescribe antiviral medication to shorten the length of the illness or help prevent serious complications. So make sure to get the flu shot this year in order to protect yourself and your loved ones. Prevention is key, so always remember to wash your hands, cover your mouth when you cough, and do not share any cups or utensils with someone who is sick. With these simple tips, you'll be enjoying the colder weather instead of being stuck home sick. For RX Wiki, I'm Shelby Cullinan.